All right, everybody. I think we are now, not sure if we're live, but we certainly have people present. And does that mean, Tim, that we're ready to go? We're live now. All right. So with that, I'm going to get us started. Welcome to our electronic committee of the whole meeting on January 11th, 2022. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing and everyone is participating electronically. I'm going to start by calling on Caitlin Gillis to conduct the roll call, please.
Thank you. Chair Redmond?
Present.
Councillor Armstrong?
Present.
Councillor Clark?
Present.
Councillor Erb?
Present.
Councillor Foxton?
Present.
Councillor Galloway?
Present.
Councillor Harris?
Present.
Councillor Jaworski?
Present.
Councillor Jowett? Councillor Kiefer?
Present.
Councillor McGarry?
Present.
Councillor Nowak?
Present.
Councillor Shantz?
Present.
Councillor Strickland?
Here.
And Councillor Verbanovic?
Present.
Perfect, thank you.
All right. I will start with the land acknowledgement. I'd like to acknowledge that the land on which we gather virtually today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements and their contributions to our community. What I've learned is that I'm privileged to have opportunities in my personal and professional and political lives to participate in reconciliation efforts, and with my privilege comes responsibility to do that. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we're on to our first presentation, and I would like to welcome Dr. Wong for the 19 update. Vicki Murray will also be present to provide, or may also be present to provide a vaccination update and may be called on if she's available. So perhaps Dr. Wong can clarify just so we can keep our questions addressed to the right people. I'm not seeing Dr. Wong. Are we early?
Vicky's here.
All right, then let's start with our vaccination update.
She's just coming online now.
Sure, I'm glad to start with the vaccine update if you'd like.
Please do.
Okay. Thank you very much, Chair, and good morning, everyone. I'm always glad to have an opportunity to join you with an update on our regional vaccine rollout. I'm going to start this morning with a review of our numbers. As of yesterday's vaccine regional dashboard update, we had 86.8% of eligible 5+ residents had received one dose, and 80.62% of eligible 5+ residents are fully vaccinated. 47.54% of children aged 5 to 11-year-old have received one dose, and we have given 211,419 third doses in Waterloo region. When you dig deeper into that, about 79% of our 80+ residents have received their third dose. Our estimate right now is that approximately 50% of all eligible residents have received their third dose as of yesterday. A lot of effort has gone into providing vaccine appointments at our regional clinics over the past month. Almost 64,000 appointments for first, second, and third doses were made available to the public in January. As of yesterday, approximately 35,000 appointments were booked, which means there's still approximately 29,000 appointments available to book into. This is a bit new for us, as in December, the appointments were filling up faster than we could get them, but now there are approximately 45% of appointments that have not been used. Both Binghamton's and Pine Bush have a significant number of appointments available this week. I'd like to encourage everyone who has an appointment later in the month to move ahead and get their third dose vaccine earlier. This can be done on our booking system by booking a new earlier appointment and canceling your old appointment. There is a new calendar system in our booking system, which is making it easier to find dates with open appointments. Everyone over the age of 29 will be offered Moderna, which is a great vaccine. Studies are suggesting that Moderna may provide somewhat higher antibody levels, and its protection may be more durable than Pfizer's. Please don't walk away from a chance to get a Moderna third dose. We've been working with partners across the region to provide extra options to make vaccine available. This includes clinic options for hospital and long-term care healthcare workers, clinic options for educators, childcare professionals, and first responders, welcoming all pregnant residents to walk-in clinics for any dose. We have many business-led clinics for staff and family. We've done outreach to our 70-plus residents to provide options for third dose vaccine. We've been connecting with the local HT teams to provide additional vaccine opportunities, and we've increased children-specific vaccine appointments. As well, we've been in consultation with our community leaders to identify clinics that will ensure we provide clinics that are available to specific communities. Promotions for these clinics will only take place via community sites and leaders. These clinics, which will start this Sunday and run Sundays to Thursdays, provide walk-in for first, second, and third doses for everyone aged 5 and up at the request of our partners for those communities. Pharmacy and primary care, of course, are providing many opportunities for doses every day and are a great resource for our community. We'll continue to provide updates as plans progress, partnerships develop, and we make gains on vaccination opportunities. I appreciate the urgency of the situation, which is why we continue to ramp up, and we are trying to provide earlier opportunities for people to get their vaccine. Thank you.
Thanks very much. I see Councillor Vrbanovich with a question.
Thanks very much, and thanks, Vicky, for the incredible work that you and your team have been doing over the last over the last year and a bit, but in particular over the last month, and hopefully you got a little bit of a break holidays. I just want to confirm those numbers. In January, you said there were 65,000 doses made available, or available, and there's still 29,000 left. Did I hear that correctly?
Yep, I was surprised at that as well. And I think, we couldn't get appointments out there fast enough in December. And so we've really worked hard to add more appointments. I know at Pine Bush, they added 6,000 appointments this week. So I think it's just all that work is we're finally getting ahead and, really glad to have more appointments available quicker for people.
No, that's fantastic, and we'll certainly push that messaging out. I know one of the things that many of us have been pushing for is vaccines for those working in education as well as for kids, and I'll get to the kids part in a minute because I think we've got some challenges there. But I'm wondering if you can just speak to the educator piece in particular and what we've been able to put together with the school boards.
Yeah, thanks for that question. Of course, the school boards are very important partners with us, and we've been working closely with them to provide some educator-specific vaccine clinics. So those are in progress and happening, as are some other specific clinics for other groups, like healthcare workers, for long-term care as well. So those are happening as we speak.
Okay, and that information is being shared with educators through the boards themselves?
Yes. Mm-hmm.
Okay, and I presume we're also making sure that we're including all the boards as well as the independent schools?
Absolutely, we wouldn't forget them.
Okay, wonderful. On the child front, our percentages, not just here but in fact across the province, are lower than I think all of us had hoped for. I'm wondering if we can just talk a little bit about what we're doing to promote this. And I'm wondering, is there some stuff from a communications and that we might consider if we're not already? Like in particular, I think, what are the radio stations, for example, that young parents are most listen to, and so can we perhaps take some pediatricians locally and develop some ads and run those on those radio stations as a way of encouraging parents and so on? Wondering if you can talk a little bit about that.
Sure, I can. That was part of our strategy quite early on, and we did engage with some pediatricians and some specialists to help provide extra information around the vaccination safety and efficacy for children. And I think that some of that information did get out quite early on in our children's rollout. It's very possible with Omicron and the push for third doses that messaging has gotten a little lost right now. And I think that is really going to be one of my focuses in the next couple of weeks, is to revive some of that work and to really focus on getting the important messages out there around the safety of the vaccine for children and how important it is to help protect them as well.
That's great, and particularly with respect to those who haven't had first doses, and as we look to go back to school now, is that a priority group? Like, is that a walk-in situation, or do they still need to book with that age group?
At the moment, we're allowing walk-ins for children at our boardwalk location. We're not quite ready to open it up at all locations, but it's something that we are keeping a close eye on. And I've been discussing with the team. And as soon as we feel that the clinics can confidently handle walk-ins, we would be opening it up across the board. We're not quite there, but getting very close to that. I actually did see some numbers and was pleasantly surprised by the number of first doses that we are still doing in our community. So there are still people of all ages who are getting first doses, and we are tracking that as well.
Yeah, the story in Quebec with their new mandate is that first dose numbers have gone up significantly since folks were told that they won't be able to go into liquor stores and cannabis stores. So maybe that's a direction for Ontario to consider going forward. Thanks again for all of your great work.
Thank you.
Councillor Jowett.
Thank you, Chair Clark. And so I just want to bring some attention to some challenges that came up over the weekend. And I know that this is not the region's lane per se, but there's great concern in Cambridge.
Hard to hear you, Helen.
Yeah.
There's some concern in Cambridge that we haven't had a pop-up as of yet. So 5 have been announced and we haven't seen one in Cambridge yet. And I can honestly tell you, with the business partners, the objective test opportunity allows for a tool to be able to say, I can't come into work. Without that objectivity, people are either coming in and infecting everyone and upsetting an employer, or they're not coming in and being questioned as to whether they have realistic symptoms or not. So I'm a little bit frustrated. I spent a fair bit of time on the weekend working with partners, certainly Mr. DeRocher from the Chamber, trying to draw attention to the fact that we haven't had a pop-up yet. And I know that this is, again, not our lane, but I'm hoping that everyone here will advocate on behalf of Cambridge getting a pop-up, because as you know, we are trying to build relationships with our area municipalities in the name of autonomy, transparency, and equity, and I believe that this is problematic. So again, we've reached out to as many as possible, so I'm hoping that my colleagues here will shine a light on the inequity as well. And I don't like to say poor Cambridge, but this is pretty important to business. We've already suffered a significant amount of stress and loss in the business community. So just wanted to put that out there. If anybody can do anything, I'd really appreciate the support and help.
Councillor Jowett, I couldn't quite hear you at the beginning. I think you're talking about the rapid antigen testing distribution pop-ups rather than vaccination.
I am talking about the rapid antigen testing. Thank you, Chair Clark, for clarifying. I appreciate that. again, I can't tell you how frustrated we are. We spent a lot of time this weekend, and it'd be really nice if we had other people supporting us. So thank you for that.
Dr. Wong, do you have a comment on that or any information to share, or is that simply something you will note?
I may refer to Bruce. This is a provincial responsibility.
Thank you. Mr. Lochner?
Sure, thank you. Madam Chair, through you to Councillor Jowett. Yes, appreciate the frustration, and we have reached out to the Assistant Deputy Minister to try to get clarification as to how tests are being distributed, and I haven't heard back yet, but we'll continue at it this week.
Chair Redmond.
Thank you, Chair Clark. Through you to Vicky. Vicky, can you just talk a little bit about the planning of vaccine buses and mobile units? I know one of the cornerstones of our strategy has been reaching out to community where they are, and I think it's just good to have an update for council and for the community.
Thank you, Chair Redmond. I'd be glad to. Throughout the vaccine rollout, we've been very engaged in working with our community partners to identify specific locations that need vaccine clinics. And that work is continuing with third doses and with children's doses. So what we do is we look at vaccination rates in certain communities. We look at number of COVID cases, and of course, in connection with the community leaders for those areas. And that's how we plan where we're going to take a vaccine clinic. But it's very much a regional approach. We definitely keep our eyes on all cities and all the townships to make sure that we aren't missing certain townships or certain areas, and really doing that with a focus of how can we get the vaccine to the people who can't get to the vaccine. So it's been effective so far, and that strategy is being built into those mobile clinics that I mentioned earlier, which are running from Sundays to Thursday. And I think as January progresses and the third dose numbers continue to increase, that we'll be able to do more and more of that outreach, and that certainly is on our radar.
All right, Chair Redmond.
Thank you.
Councillor Foxton.
Thank you. So we've been looking for a vaccine clinic in North Dumfries, and there was one planned and it got canceled, which was very frustrating to a lot of our people. And so I included Vicky in the emails yesterday because our counselors were emailing back and forth saying what's going on and all this stuff, only to find out from my staff that they had tried to have a clinic through Langs, and Langs did not have the availability of staff to run it. So working with Vicky, we're hoping to, our council's hoping to put together a clinic, because we have a multitude of medical staff living within our community who are retired or presently working, who may volunteer to help run that clinic. And we're going to try and work with Vicky to get one put together rather quickly if we can, Vicky. So as soon as we find out the criteria of what we need to do to pull it together, and I'm hoping you'll send me that, then we will reach out to our community and see if we can get to help man it.
Thank you, Councillor Foxton. I'm very glad to work with you on that. And, you know, we have had those conversations with Langs early on. So I do have a bit of background, and I'm absolutely willing to investigate that further and work on it with you.
Thank you so much. So sometimes it's not that we're being ignored, which my council felt they were, but it's actually the ramifications of the burnout of staff in all the places, in all the medical system within our society today. And I'm sure we'd get more done if they weren't so burnt out and tired. And also, I mean, there's a comic in a book where a man's lying in a medical bed calling for a nurse, and in the bed beside him, the nurse says, "I'm here." You know, it's that type of situation, which is terrible in itself. So we'll get through this doing it together. Thanks.
Yes, we will. Thank you.
Councillor McGarry.
Thank you very much. And through you, Chair, to Vicky, again, my thanks for doing an incredible amount with your team to get vaccinations in arms as quickly as possible. On this morning's OHT Cambridge and North Dumfries team, they were certainly trying to support all the efforts to get as many doses in arms as possible through all the OHT partners, and certainly mention how incredible your team's been in order to help support it. But you're quite right. There is certainly staffing shortages and resources in trying to even draw up the doses. So trying to share as much as possible to get doses in arms. My question to you, just ahead of a couple of comments about rapid access tests, would be around the 5 to 11-year-olds. I know that we've all been concerned that under 50% right now from the 5 to 11-year-old group has been vaccinated. The province is certainly motivated to do everything possible to get kids back to school on January 17th. And at the Ontario Big City Mayors meeting that we had yesterday, we certainly sent out a resolution supporting everything that we could do. And that included encouraging families to get their 5 to 11-year-olds vaccinated. So that would be my question to you. And I'm just going to make a couple of comments about rapid access tests, which we discussed yesterday in Big City Mayors. I know Councillor Verbanovich was there on the call with me. And it was noted that with the rapid access test shortage, many of our frontline staff, including those in our municipalities that are running critical services, are also short of tests. And there was a bit of criticism from some of our colleagues across the province that the province was actually putting out, 15 to 1,800 tests through some of the venues that we've seen in malls and markets recently that Councillor Jallett was talking about. But in reality, we need to support our critical services team, and they need to be a priority with a shortage of tests before we can get out to the general public. So that's, of course, a conversation that's going on at upper levels of government, but I would still support that our frontline staff, critical services staff, get the rapid access tests first. Anyway, that's just my comment, and now I'll turn it to you, Vicki, for any other strategies that we can manage to do to encourage the 5 to 11-year-olds getting vaccinated.
Yeah, you know what? We've strategized on that quite a bit in November before they were even it was even approved, and so I think there's some work there that has to be done on getting those messages out again. Like I mentioned earlier, I think they've actually been lost a little bit, and so we really want to rework that message and work with our partners to make sure that we can answer the questions that people are having. If there's a question that is making people reluctant to get their children vaccinated, we want to make sure those answers are available for everyone across our community. So there's a lot of work been done on translation and doing this education in a variety of languages, and we will continue to do that. We will continue to work with the school boards on options as well for children's clinics. So I think there's, upon reflection, it was hard with the timing, right? Because the children's vaccine was approved pretty much just as Omicron was arriving at our doorstep. And whether that has reflected on our lower rates for children's or not, I'm not sure, but it certainly has reflected on our ability to be able to do the outreach we wanted to. So now that perhaps demand is managed better for the Omicron third doses, we can put some more effort into the children's vaccine.
I do see you, Councillor Jowett, but there's a couple of councillors who have not had a chance to speak, so I'm going to jump to them and I'll come back to you. Councillor Erb.
Thank you, Chair Clark. Back to the 5 and 11-year-olds, and I know this is looking out into the future, but that age category have not been approved for boosters. And so I'm wondering what the thinking or the science on that is. And then also the second question, the fourth booster is now being administered in long-term care homes and in some vulnerable groups. And again, the thinking on that, how wide a distribution we may think that might take place in the community beyond the long-term care.
Vicki, do you want me to start and you can jump in?
I think
Thank
you
you.
might want to. Thank you.
Okay, thanks for the question, Councillor Erb. So regarding the 5 to 11, it's because right now they are following the science, and it's a group that is getting their first and second doses now, and then we'll have to see whether or not in the future they may require a booster or not. We wouldn't be able to tell right now because they're just getting their first and second doses now, and we'll have to see how long the immune response lasts in this age group. We do know that for populations like those in long-term care and those that are immune suppressed with severe conditions, for whom the government has previously prioritized third doses ahead of others, they're continuing to follow the evidence for that group as well, and they've noticed that that group could benefit from a fourth dose. So that's why it's being recommended now for those groups, and whether or not that recommendation will expand to other age groups remains to be seen. They will continue, the provincial and federal experts that look at the vaccine studies will continue to monitor this to determine, if and when other age groups will be available for future boosters. So it really does depend on what the evidence says for particular age groups, or for, in the case of those in long-term care with severe immunocompromising conditions, what the evidence says, their particular response as well. So, it will just be it'll be something that we'll have to see as the evidence evolves on those questions.
And I understand it's a bit of a waiting game with the 5 to 11-year-olds to see what happens with the second shot that they're getting, and how long that immunity will last. But it's good to keep it in front of our mind, because we have seen how fast things change. And thank you for being so agile and the hard work you're putting into all of this. Thank you.
Councillor Galloway.
Thank you, Madam Chair. I've got two questions. The first one has to do with the 5 to 11-year-olds as well. Since I raised it at the last update, there's been a fair bit of social media stuff, and I've been contacted by a few people who wonder, what does it take? What is the criteria for vaccines to become mandatory for school-age children, the same as measles, et cetera, et cetera? I suspect there's a protocol, there's a process. It probably wouldn't happen for some time, if ever, depending on the criteria. So I'm just wondering, just for my own edification, I could pass it along to people. How does that happen?
It is a provincial government decision whether to add a vaccine to the Immunization of School Pupils Act or not. So that's really the step. There isn't another process by which vaccines are added or not. So.
But is there Dr. Wong, is there some kind of criteria, or has to meet certain parameters, certain amount of time that would have to pass before something like that would?
There are no set criteria like that, but it's true that for the vaccine preventable illnesses that are under the Immunization of School Pupils Act currently, they are vaccines that people have been getting for a number of years, and but there is no set criteria. It really is a provincial decision.
Okay, that's fine. The second question, Madam Chair, is the The anti-vax lobby group is really well organized and well funded, as people know. And with the Omicron variant and the resultant stresses and strains on the hospitals, which we may or may not have seen the worst of yet, cancellation of elective surgeries and so on, the anti-vax lobby is now pretty well uniformly pointing to the failure of the provincial government to adequately staff up, bed up, whatever it is for the pandemic. And I think it's a diversion on their part away from, admitting that unvaccinated people are multiple times more likely to be in the hospital, and 8 to 10 times more likely to be those that are occupying beds in ICU. And so they've kind of diverted the attention away from the facts and trying to suggest, well, it's the government's fault that they haven't adequately staffed up or bedded up the hospitals. But I do believe that the hospitals have done a fair bit in terms of accommodating or being ready for this. And I know Lee Fairclough is not on the call, but I'm wondering if we could maybe ask her to maybe itemize again what initiatives the hospitals have taken in order to staff up or create more capacity, because they've converted beds into ICU beds, and of course they have canceled surgeries and other activities, and they're also dealing with their own human resource issues associated with the variant. So I'm just not quite sure how to respond to some of these people who are alleging that the government hasn't done anything. And I'm not trying to defend the government, but I do believe that they have, and the local hospitals on their own have done a fair bit in order to create more capacity. So
I guess saw Mr. Lochner wave at the camera.
Sure, through you, Madam Chair. The hospitals are doing weekly updates now, so we can pass that along to the CAOs, and I'm sure they will update as part of their weekly update this week. It's a great comment, and we know our hospitals and their staff, as you said, are doing heroic work and have for 2 years, and those kinds of comments I think are outrageous, but we'll have the CAOs comment. Thank you.
Yeah, they are outrageous, but it's a uniform effort that they're undertaking. You can see it quite clearly, and it'd be nice to have kind of just a bullet point list of things that our local hospitals at least have done in order to deal with this. Thanks.
Councillor Jowett, back to you.
Thanks, Chair Clark. We're still at 50% with our kids, I understand, or sorry, 40 something. And so a couple of people have reached out and said, and this is absolutely not to diminish the credibility of our own fine staff who have, in my opinion, led us and led the region quite strongly. But can we get a pediatrician, or because I got to tell you, what we're up against is a lot of different naturopaths, and I see the validity in those as well. But if we're only at 50% with the kids, I worry that we're going to be hanging on to the next strain of this or whatever else that looks like. So, is there an opportunity to have a pediatrician come and speak, Dr. Wong, or we haven't considered something like that, or what are you thinking?
Yeah, I know the vaccine team, and Vicki, please jump in anytime. Working with experts like that in our community, and I think, as Vicki mentioned, that was put out a bit earlier, and it may have gotten a bit lost with the third dose opening up to everyone at 18 plus towards the end of this year. And so I think we're going to relook at how we can renew some of that, some of those efforts in getting good information out again. I don't know, Duke, if you want to add anything further.
Absolutely glad to do that. We have had pediatricians working in our vaccine clinics. When we did the Every Dose Counts weekend at Pine Bush, we had pediatricians. I had the opportunity to speak with a couple of them and was really appreciative of them coming in. We did have a pediatrician on one of our community updates in November. And they have been helping us again with some special videos with information, but it's absolutely something that can be relooked at. November really wasn't that long ago, but it really feels like it was long ago, right? So
part of the problem is when they're coming into the sites, they're already sold. I think it's getting them other information. And I like I said, I don't undermine naturopathic ways and other choices. I just don't know that we've come out provincially or otherwise strongly on herd immunity of children, and it might be somewhat helpful in that regard. The other thing I just wanted to highlight here is our economic development folks are getting messaging coming to us. Last week, only one of our constituents who runs a restaurant group had to lay off 800 people. I get that the first responders should get these test kits first, so I take absolutely no exception to them being at the front of the line. Where I do have a bit of a challenge is I know there's a local business who wants to sell test kits who pivoted immediately when COVID hit, and they're sitting there waiting to supply, and these are the things in government that are so extremely frustrating. I know we're all doing our best to try and plug the holes of these, and I know this isn't our lane as well. But what is our lane is to continually push up the information that can help change some of these bureaucratic gaps or that cause us some of these problems. And I know every one of us has contacts. So if every one of us is acknowledging some of these barriers or gaps and speaking to our contacts, may they be different or the same, the word still rises to where it needs to be heard, I suppose, is what I'm asking. And again, absolutely no diminishing the great job our staff have been doing, and certainly our task forces in this regard. I hope that's not any kind of messaging that I'm trying to send. I'm a little bit more frustrated by trying to get the appropriate level of information up the food chain. I mean, imagine one company, one restaurant in the region laying off 800 people, young people who have had COVID, the variant that was not very strong. They've had their symptoms and they're done and could be back at work, working in tents, which, by the way, there's so many weird things around this that have people questioning the entire COVID situation, which we are stuck with, which creates the vaccine hesitancy. For example, why can I sit in a closed tent with patio heaters, but I cannot sit in a restaurant? And we're not going to fix, I'm not saying we're going to fix all those things, but gee whiz, I think it behooves us to keep asking questions, intelligent questions, sharing that information with our contacts and fixing some of these things that end up being ramifications that impact our ability to do our job, i.e. get vaccines in arms. So that's it. That's all I'm trying to say. So thank you, guys.
We kind of flipped our order this morning, and I'm wondering, we now have all our vaccine questions out of our system. I'm wondering, Dr. Wong, if you would like to take us back to the beginning and do the COVID update.
Yes, thank you, Chair Clark, and I apologize for being late. I was having trouble logging on, and also because the order has flipped, it really gives me an opportunity to thank Vicki again tremendously for all her efforts and her leadership of the vaccine team. Thank you so much, Vicki. Okay, if we could go to the next slide, please. Thank you, Kathy, for forwarding my slides. I'll start with the key messages. One, Ontario and Waterloo region are currently on the ascending curve of the Omicron wave. Two, our healthcare system locally as well as provincially is under tremendous strain, as you are aware. Three, vaccines are key to our long-term success against COVID-19. Vaccination protects severe complications from Omicron, and it's not too late to get a first, second, or third dose. And finally, following public health precautions continues to be important to help slow the spread during this time of very rapid circulation of Omicron. So please limit your social contacts, optimize the fit and filtration of your mask, and wear it outside of your household, around those outside of your household, and avoid poorly ventilated places and enclosed spaces. So if we go to the next slide, please. Regarding hospitalizations, which is a common question these days. So beginning last Friday, as CAO Lochner indicated, local hospitals have begun providing twice weekly public updates on the status of hospital care in the Waterloo and Wellington Guelph area, so in that larger Lynn area, so to speak. So last Friday, hospitals noted that both patient occupancy and work shortages have increased sharply over the preceding week. And patient admissions related to COVID-19, as you can see on this chart, have significantly increased both locally and provincially. So in their update, the hospital CEOs said that patients with moderate and severe COVID-19 symptoms are being admitted alongside patients with other serious conditions, not COVID-related, requiring acute care, and that whether patients are admitted for COVID-19 upon admission or they're found to be positive after arrival, both human health resources and space for isolation is required, which does impact capacity and flow within hospitals. So data as of January the 8th noted that there were 94 patients with infectious COVID who were in our local Waterloo region hospitals, with 13 in ICU. So this was our highest number of patients hospitalized with COVID-19 since the pandemic began. And the hospitals will be providing another update later today. Next slide, please. Just a few more items related to our current trends. So the local trends that we're seeing are mirroring the provincial trends. So in January, we are seeing the highest levels of spread of COVID-19 than we've ever seen since the pandemic began. And commensurate with that spread, as of yesterday, we had 31 outbreaks in long-term care and retirement homes, 21 outbreaks in other congregate settings, and 6 outbreaks in local hospitals. Current booster dose coverage, current and increasing booster dose coverage will help blunt the serious impacts of the Omicron variant on our local healthcare system and on our community overall. Now that testing is being prioritized for only a subset of our population, we have an advantage here in Waterloo region in that we have wastewater monitoring. So our wastewater trends will help us monitor the progression of the Omicron wave as it goes through in our community. The wastewater signal in the last few weeks, according to our wastewater researchers, has increased dramatically and has recently been as much as 10 times higher than during previous waves. So I think what that can tell us is that the cases that we are now detecting through PCR testing that's limited to only highly prioritized groups is only a fraction of the number of cases that are out there. And as you can see from the chart, the level of COVID-19 in our wastewater is extremely high right now, the highest it has ever been in the pandemic. And wastewater finally will likely also be able to help inform, along with other indicators that we have, when the current wave starts to subside. So it's good we have that additional tool in our region. And if we go to the last slide now, the vaccines provide powerful protection against severe outcomes. That's been true since the beginning of the rollout, and we continue to see that that is true. So the following graph that you have in front of you is taken from the Ontario Science Tables dashboard as of yesterday and shows the rate of COVID-19 infections, hospitalizations, and ICU admissions, respectively, from left to right, among those who are vaccinated with 2 doses in the blue, compared to those who are unvaccinated with no doses in the orange. So as you can see, the risk of hospitalization and ICU admission continues to be much higher among the unvaccinated, many times higher, as Councillor Galloway had mentioned earlier. A booster or 3rd dose of the COVID-19 vaccine further protects against severe complications of Omicron. And as Vicky already mentioned, we highly recommend that members of the public take whichever mRNA vaccine, so either Moderna or Pfizer, that is available to them first. And as also Vicky mentioned, Moderna is currently being given to adults 30 years of age and older, and it is safe and highly effective. There is emerging evidence, in fact, that Moderna induces somewhat higher antibody levels, and its protection may be a little more durable than Pfizer's as well. So I would strongly discourage people from refusing Moderna to wait for Pfizer. If you are pregnant, it is especially important that you get vaccinated for your protection as well as the protection of your baby. So with the very extensive spread of Omicron, hospitals are seeing more admissions of infants with COVID-19, and maternal antibodies that a pregnant vaccinated individual would be able to pass to their baby can help protect baby in the first 6 months of life. And finally, if you had COVID-19, including Omicron, because I know many are being infected right now, you should still get your 3rd dose to increase your protection. If you are eligible for a 3rd dose because it's been at least 3 months since your 2nd dose, you can get your 3rd dose once you're out of isolation. And that's it for my update this morning. I'd be happy to take any questions. Thank you.
Right, and we'll start with Councillor Foxton.
Thank you, and great presentation, Dr. Wong. That last slide is powerful. It's really powerful. Can we get it shared onto social media and sent out? Because that really sends a message without saying a word. Just putting that document there sends a very clear picture and message. And so if we can get that shared, that would be wonderful. Thank you.
Yeah, will do. Thank you for that suggestion.
Councillor Verbanowitz.
Thanks very much, Chair Clark, and thank you, Dr. Wong, for the update. I mean, without question, these are challenging times, and we're seeing it clearly everywhere, but particularly in the healthcare sector and in our long-term care and retirement homes. where the staff of those institutions and quite frankly the residents and patients are really feeling it. Just on that last point, and I will say, I know often you both here and in the briefings you include some great slides, and I'm just wondering if staff can make a point of starting to always circulate those to us in an email, so that we all have them, because it certainly also helps us as we do social media. On that last slide, though, I'm wondering, and I think Councillor Foxton is right, it's great information, but I'm wondering if it would make more sense to show vaccinated versus unvaccinated as a percentage of that overall group. And I say that, normally looking at it in the context of, X number of people per 100,000, creates equity as we do analysis between one municipality and another. But right now I'm finding, because the vaccinated folks represent roughly 80, or we'll say 90% of the overall, or I guess over the over 5 population, it's 80% with at least one dose, and the others represent 20%. Because of the high numbers we're seeing with Omicron, people are going, well, see, what's the point of being vaccinated? Because look at all the vaccinated people who are getting sick. Well, those numbers are as high as they are because they represent 80% of the population. But in reality, it's a much smaller percentage of people who are vaccinated that are actually ending up in hospital or ending up in ICU versus the percentage of people who are unvaccinated that are ending up in hospital and ICU. And so I think we need to just try to communicate those numbers a little better. And I'm not sure actually looking at overall cases is the most helpful way in this particular instance.
Thank you for your question. Yes, there's been some confusion. So the provincial government, usually through Minister Elliott's Twitter account, provides raw data on the number of vaccinated versus unvaccinated among the number of cases. So you're absolutely right, because most people in our population are vaccinated. You have raw numbers that show more people who are vaccinated are among those cases than the unvaccinated. But because you're only taking the population of those that are the cases, and if you do those calculations as a function of the number of cases among the vaccinated over all those that are vaccinated compared to the number of cases that are unvaccinated among all those that are unvaccinated, which is what groups like the Science Table and Public Health Ontario publish, then you see that the risk of being hospitalized or in ICU, if you're unvaccinated, is many times higher. So it's that relative risk that you have to use. And it does create confusion when the province puts out the raw data without the denominator data versus, when the scientific bodies put it out, they put the rates, which is the appropriate way to go. So that feedback, is being provided up to the province to ask if they could provide some of that information in a way that kind of aligns with the more appropriate way of demonstrating the risk. I know Dr. Moore does mention the relative risk, but I think perhaps as part of their commitment to getting out numbers very quickly, the province is just pulling the raw data. But you're correct. With Omicron, we are seeing that 2 doses of vaccine and 3 as well isn't as protective against infection as with the previous variants, but it's still very, very effective against severe outcomes like hospitalizations and ICU. And in fact, that was always the objective of the vaccines. It was never really to stop all spread. It was to prevent severe complications. It was a bonus in a way that previously it was also able to have a very big impact on spread. That's no longer the case with Omicron. It isn't that effective in that regard, but it remains very effective for severe complications, which is what we're now trying to do, which is really our overall objective now going forward, which is to blunt the severe outcomes of this current wave. So thanks for the question, and the feedback is being communicated to the province.
Yeah, thanks. Thanks for that. The next question I have has to do, and I understand, it's all kind of complicated and situation specific with respect to, are you on a 5-day self-isolate or a 10-day? And the 10 really applies to those who are interacting with a hospital or a long-term care facility or any congregation kind of setting. But as I understand it, others generally are 5 days. And I'm asking because I've heard from an employee in a local establishment who just yesterday was in touch with public health and was told 10 days, but it's a regular office setting. And so I'm just wondering if we can get some clarity on that, because there is some confusion, it seems.
Yeah. So one of the reasons that it can be confusing is because 10 days can be 10 days for isolation or 10 days that you have to avoid since you've been exposed interacting with those that are more vulnerable, right? So it's 10 days can be used for one of two different situations. So for most people, that is people that have had 2 doses already, if they've had 2 doses and they are not symptomatic, that's for exposure. I'll back up. If they've had 2 doses, they only have to isolate for 5 days, assuming that on day 5 they've been getting better for the last 24 hours. But for people that are either unvaccinated, partially vaccinated, or that are immune compromised, because they may continue to shed longer than vaccinated people, the period of isolation is 10 days.
Okay.
But you're right that there's an additional 10 days that's used for when people, even if they've been fully vaccinated, they should avoid contact with more vulnerable people like the immune compromised or those in long-term care, because that is not used for their personal isolation, but it's used for the interval that they should respect between when they've been exposed to a case and when they then interact with someone who's more vulnerable. That's a more conservative window for the more vulnerable persons like that. So you're right. There's a little bit of that element which can make it confusing.
Yeah, and that last piece you just talked about made a whole lot of sense to me. It was the other two, but I think you explained it there with the vaccinated versus unvaccinated or partial vaccinated in the 5 and 10 days. So that's really helpful information. Thank you again for all you and the team are doing.
Thank you.
Councillor Shantz.
Thank you. And my question was basically answered. I was playing with the stats too because that's so much fun, right? But I did make a note here. A lot of people aren't interested in playing with the stats. So in my mind, I think the important message to get out is if I'm unvaccinated and I come in contact with someone who is COVID positive with Omicron, what are the chances I'm going to end up in the hospital versus if I'm fully vaccinated and come in contact with someone, what are the chances that I'm going to end up in the hospital? So I think, from a, straight out, what are people worried about?
I think that would probably be a good way to present it.
Mhm.
I'll take this opportunity to just let council know that these slides are given to us after the meeting, and they'll be included in the meeting minutes, so you will have those. Although I do agree with Councillor Verbanovich that I think I don't find the slides satisfying, because I think they need to be corrected, because they're misleadingly reassuring for people who aren't vaccinated if they don't take into consideration the fact that the vast majority of us are. Or another slide needs to be added to show what we would expect those rates to be if we did in fact have equal numbers.
Yeah, sorry. Just to confirm, those are slides from the science table.
I understand.
So yeah, right. So, but I think the slides that are circulating, or that the data that is very much circulating on the internet that is causing confusion, are the ones from the province, from Minister Elliott, that give just the raw data. Yeah.
Thank you, Councillor McGarry.
Thank you, Madam Chair, and through you to Dr. Wong. Again, my thanks to you and your team for continuing to do what you need to keep us as safe as possible, and also to look at all the data. Some of my questions were answered already, and one of those was what you were talking about, raw data versus what the percentage of unvaccinated risk is for being hospitalized or ICU. So thank you for that. My question is really regarding some of the rapid access tests that people are doing at home. We've discussed before that the data for those tests and who's testing positive or negative is not tracked, and it's not just in the province of Ontario or Quebec, but it seems to be a real issue. Are there continued efforts to try and get people maybe to log on to a website and sort of track the response that they're having, if they're doing it either at home or in a workplace, to capture some of the data about our rapid access tests?
Thanks for the question, Councillor McGarry. So rapid access tests, the access to them, as Councillor Jowett and others have pointed out, is very it's not equitable, right? Across the province, there's certain people that do get access for good reasons, because they're healthcare workers, et cetera, and they need to take the test every day. And there's not a lot of uniform availability of those tests, and there's also, it's also not uniform the number of people that actually want to submit the test. So some places, a few places in Ontario, are trying to track. Oftentimes these are citizen started initiatives where they're trying to track the number of people that self-report their tests. But I think that the challenge with that is you are going to get results from a percentage of those who have access to tests and then who want to report. So it likely isn't very reliable. And that's where our wastewater monitoring provides us an advantage, because the purpose of that really is to try to, you would not do anything with those test results. You wouldn't follow them up. It would just be to give you a sense of maybe, in addition to the PCR results, are there others in the community being infected? That's what it's meant for a monitoring purpose, right? Because the PCR tests are more limited now. So that's where we have the advantage with wastewater, because we have a much more systematic way of assessing, what is likely the rate of infection out there compared to what are we discovering via PCR tests. And so that's where I feel, for us to stand up another surveillance system locally on our own, that would take resources. We wouldn't do anything with the data beyond what we are already seeing with the wastewater, which is, as I mentioned earlier, up to 10 times higher. So that does give you a sense that the rate of infection is much higher in our community than what is being captured by the PCR tests. And it's really also used just to try to see, when we maybe on the descending part of the curve. And again, wastewater monitoring can fulfill that need for monitoring on a much more systematic, widespread basis. So for us here, my assessment is that it would be of more added value from a time investment perspective and from a what would we do with the results perspective to use our wastewater monitoring for that type of monitoring.
Thank you. I think it's an excellent answer and will help me to answer a couple questions. I was on that track anyway, but again, at Big City Mayors yesterday, there was a bit of discussion about wastewater surveillance. And I know that the region of Waterloo has been quite a leader here, and my kudos and my thanks to all those that have set up the system. But I would agree, I think the citizens will be very happy, as all of us will be, when we start to see the descending curve on our wastewater surveillance. So thank you for a very fulsome answer.
Thank you.
I see no other questions. Thanks, as always, Dr. Wong, and thank you, Ms. Murray, for everything you're doing. I read in the Globe and Mail, I think it was yesterday, that they expect we're about 2 weeks out from the peak in Ontario, and I hope that's true. 2 weeks or less. And if I'm wrong, don't say it. Don't correct me.
It would be within what currently is projected, yes.
Thanks very much. All right. We are going to move on. We have one delegation coming today. I don't see her on the screen, but I hope that she's still with us. I heard something, but now I don't. I am going to remind all delegations of some guidelines for participation. Hi, Nina. Well, I'll be with you right in 1 second, please. Thanks for joining us. One of the requests is to leave your video camera turned off until you're called upon to speak, and that's fine because you're up. You have 5 minutes to speak. And we will also ask that you leave the meeting once your issue's been addressed, and you are then welcome to watch the remainder of the meeting being webcast live via YouTube. I'm not anticipating that this will be a problem, but because we always do ask this, I will repeat it. If you conduct yourself in any of the following manners, it will result in an immediate removal from the meeting, interrupting councillors, staff, or other delegations, derogatory statements about councillors, staff, or others, turning your camera on at inappropriate times, and hate speech or defamatory comments. That being dealt with, our delegation is Nina D, our real estate broker, who's here to speak on the real estate and subclasses. Go ahead, Nina.
Thank you. I'd like to share my screen. I'm looking for how to do this. Share screen.
I'm assuming that you have the...
I have it on my screen. I'm just trying to share it.
Can clerks assist with that?
When you hit the share screen option, it should pop up with your different screens that you're able to show.
Mm-hmm.
And then if you click whichever one your presentation's on.
Okay, I haven't been able to find it.
Can you forward
right.
it to staff and they can share it for you? Caitlin,
Yeah, if you want to email it to myself.
Okay.
It's CGILLIS at regionofwaterloo.ca, and I can get that up for you.
Can you repeat the email? I apologize.
Yeah, no problem. CGILLIS.
ILLIS at
regionofwaterloo.ca.
Chair, can we stop the clock and allow her the time once she
Yes.
gets the team? Thank you.
Yes, certainly.
I have just sent that. I was practicing. I guess I didn't practice well on sharing my screen.
A skill I have not mastered either.
Thank you for your patience.
Oh, no, not a problem.
Caitlin, have you received the email?
I don't see it yet.
Caitlin,
I just sent you one, Nina, from the regional clerk's inbox if you want to just reply to it.
I see it, yep. I just sent that.
Yep.
All right, we can see it.
Okay, thank you. I would like to address the optional small business property tax subclass here. I have to provide my input on this. I've been a real estate broker for over half my life. I'm into my 26th year. I'm not going to go through my credentials, but that's as far as I'll go. My issue I have with this is the flexibility and the fact that this small business property tax class actually adds another arbitrator to our system, our housing system. So the real estate investment trusts, which are REITs, these are my references that I am relying on for my delegation. Real estate investment trusts, REITs, are a trust company that is modeled after mutual funds. REITs own, operate, and finance income generating real estate, and they're publicly traded like stocks. Now, REITs include apartment buildings, hotels, data centers, cell towers, medical facilities, offices, retail centers, shopping malls, warehouses. Cell tower, I think, is in there twice. I'm citing James Chen's definition of REITs. He's an investment professional. So this subclass, I believe, is going to include REITs, and I believe it's going to include pension fund investment properties. So this subclass of properties, what's going to happen here, I've read through this, is any tax reduction would be funded through a redistribution of municipal property taxes on other classes of property, either across all property classes or within the broad commercial and industrial property tax classes. If you go throughout this document, it's very loose. It's very flexible, definitions of who's going to be involved in this, a maximum discount of 35% of the municipal rate. The municipalities can choose whether the tax reduction is passed on to the tenants. That's also installing a program administrator and arbitrator that are to be municipal staff, and MPAC's sole responsibility is to move properties to this subclass. So the Regional Council, once again, is building a hen house, and they are going to be in charge. They're going to be overseeing the hen house that they're creating. This is the opposite of what I delegated to you on December 8th, I believe it was, when I told you that when we move away from courts and when we are building social justice tribunals, this is the issue with housing. This is what has happened since we have deviated standard in 1971. The next thing deviated from was courts and property rights. I have attached many links, in my delegation here. So the other, I do not want to see any assignment of big business taxes onto the tax base. This loose definition, these loose definitions on how to be eligible is to be determined by municipalities. Included in here, we have land. Land could be included under small business. And the dispute resolution process that we have here, when I look at this is another tribunal. You're actually creating another tribunal right under my nose when I delegated to you on December 8th that tribunals are the issue. The diversion from courts to social justice tribunals, private corporations, many times like MPAC is a private corporation which is backed by the appeal process. By appeal tribunal. This is not a good system for our housing. I've already said this, I'm saying it again. And the creation of this subclass is not appropriate. People should just pay. I understand the region thinks our taxes are too high. I agree, our taxes are too high. But putting business class onto the rest of the tax base, whether it's other business class or whether it's the entire tax base, is inappropriate. This transfer is going to be millions and millions of dollars if it's permitted to go through, and this cannot be permitted to go through. This is creation of another tribunal and more regulation. We have 380,000 rules, regulations, and laws in Ontario, and everything related to housing is monopolies. I would also like to point out that in your own study from 2007, so within your own, I have this here. Within your own studies from 2007, the definition of homelessness has been reduced to persistent homelessness. Persistent homelessness, by definition, only captures between 10 to 17% of homeless people. I've been involved on the homeless scene since the late 80s, early 90s, since the Out of the Cold program that was run through our churches.
Nina, can I ask you to wrap up, please? You're over your time.
Yes. When we define homelessness as putting the persistent in front of it, we're only looking at 10 to 17% of the picture. This is a problem right there. That was in 2007, right from your own archives. And I've included everything. I've included many further reading that I think that council should be looking at my further reading here, because I'm very, very concerned with this business subclass. And I'm not going to let this lay. I'm not letting this lay. This is the road to serfdom. And it's not the way we should be setting up our housing. It actually continues the system rather than fixes the system.
Thanks, Nina. I do see Councillor Foxman's hand. Do you have a question for the delegation?
If I may, Tina, I totally understand where you're coming from. I initially thought, what a great idea, we can help out struggling businesses. And then I turned it to my council and my staff also has relatives that are auditors. And they said, this is a nightmare waiting to happen. Yeah. And what I found shocking was on my council, 3 of them are small business owners, totally against this. So I see what you're saying. They've got good points laid out here for me to bring up at the time when we discuss this. But this is, Tina, you're exactly, I see the issues that I didn't see before without the consultation that I have received. So thank you for your presentation.
Thank you. I see no other questions. Thanks for speaking to us, Nina. I'm going to ask Craig Dyer to provide a little update. This item is on our consent agenda at this point, but there have been a few changes since the report was shared. Mr. Dyer?
Yes, thank you, Madam Chair. Oh, just confirming that people can hear me okay?
Yep.
Great, thank you. Yep, so just a quick update to the report that we had written back in December that's on your agenda today. It is an information report. I should perhaps just clarify for council that there is no staff recommendation with respect to the subclass at this point. The report was intended to be an update for council on the process that we were looking to follow, which back in December contemplated consultation with the business community in January. And the one point I wanted to make today is it's likely that we'll put that consultation off just a little bit. It doesn't appear like this is probably the best time to be engaging the business community in a consultation, as both the business community and the region look to focus our attention on the COVID pandemic. So we may push the timing out a little bit. But again, to reinforce the next steps in this process would be to undertake consultation with the business community. This was the direction that council provided to us last year that unfortunately we weren't able to undertake in the fall, but we intend to do that later this spring, and then recommendations will then come back to council to consider as to whether council wishes to implement a subclass. And the final comment would be the information that's in the report is simply to show what the decision-making responsibilities are under based on the changes to the act that the province has approved. And again, no staff recommendation at this time. That would follow the consultation. Thank you.
Thanks, Mr. Dyer. I see Councillor Galloway's hand.
Thank you, Madam Chair. Yeah, I don't think we're in a big rush on this, Craig, so I don't see any particular problem deferring or delaying the consultation. Certainly that has to take place. And I do believe we have to go through this process, no matter whether or not we're predisposed to doing this or not. It's a tool that the province has made available. And there's likely going to be a wide disparity of opinion on this. What I'm curious about, Mr. Dyer, is when it does come back to council after the consultation part, are you anticipating another part of the process after that? In other words, reading this report, there are so many variables potentially here in terms of the definition of those businesses, industries that may or may not qualify for the subclass. There's geographical parameters potentially, the size, the sales. I mean, there's all kinds of definition parameters that you could almost infinitely mix and match to come up with all kinds of different permutations. And so I'm just, what I can't wrap my head around is how would we ever come to that conclusion if in fact we wanted to do a subclass? How could we come to the conclusion of what would or wouldn't be eligible? And then secondly, or I have three items here. One is the second one is, would we know what the financial sensitivity is of each particular option, if in fact we were entertaining the idea? And by that I mean, what would be the impact on the rest of the class, or all the classes, depending, again, that's another parameter. You can spread the impact over the class or over all the classes. And again, that has different impacts, just huge permutations that could be considered here. So, we kind of would need to know, well, if we did it this way and put it onto these classes, then that would increase those taxes by X or Y. Because of course there's the class, or all the classes have to pay for this. If we're going to advantage one particular business, somebody else has to pay for it. And then the last item that I'm concerned about is the landlord issue. And so I guess that'll be part of the consultation process, whether or not we want there to be a obligation to pass along the tax savings to tenants. Seems like that's another parameter, another option. And I just can see like a horror show associated with trying to do that, to have some kind of a system that would determine whether or not the landlord has passed it on to the tenants, and some appeal mechanism that we would be responsible for seems almost incomprehensible to me. But furthermore, it seems to me we would have to have another mechanism to determine whether or not people are going to want to potentially appeal whether or not they're in the subclass or not. And it seems to me that is going to be very onerous as well, to create that definition, and then to have some kind of an appeal mechanism that people could appeal to. I suspect we would probably have to set up a committee or some kind of regular group that would adjudicate those requests from time to time. I don't think we could do it through council. So I'm wondering if all of those things would be all of the things I just mentioned would be part of the report that would come next, or whether or not that would be even further down the road.
Yep. So thanks for the question, Councillor Galloway, and through the chair, there's a couple things I can offer. First of all of the items that you've mentioned, Councillor Galloway, are definitely parameters and decisions that we would have to make. If my sense is that we probably have a two-part process here. So what could happen, and maybe what will most likely happen, is we would go out and undertake the consultation with the business community, and it would be sent, as I've tried to lay out in the report, it would be centered around, at least initially, is there a problem here that we need to solve? And is the establishing of a small business I think before we get into the details of how it would work, we need to establish the answers to those two questions. So if there's a problem to be solved, and if establishing the optional small business subclass is a solution to that problem, then we can turn our minds to program specifications and administration, which would have to deal with all those items that you've indicated. And I think, from a staff perspective, and in my discussions that I've had with the area municipal treasurers, these are all items that have come up in those conversations. And I would say it's probably reasonable to say that, there's certainly some concern about eligibility and how to define eligibility, and making sure we define it in such a way that we're assisting, again, to solve whatever problem is we've determined there is to be. So we want to make sure that the assistance gets to the right properties. Of course, it's a closed loop, as it were. And so if we reduce taxes on one set of properties, then taxes then go up on others. And so to your financial us to put in place, wanted the region to put in place, then yes, we would absolutely go through the exercise of establishing eligibility and undertaking the sensitivity so that we could clearly set out what the potential impacts would be on other properties. But again, that I think it's a natural two-step process here. I don't want to get into the weeds of program design and administration until we've established that we have a good, solid public policy reason for implementing this subclass.
We lost you a couple times, Craig. I just want to make sure, was council able to follow that?
Most of it. Maybe if you take your video off when you're responding, Craig, we might be able to not have you break up verbally.
I'll do that. My apologies. I didn't realize I was breaking up.
Councillor Galloway, you're good? Okay.
Yes.
Councillor Foxton?
Thank you. As well as my council, I had my staff go through this and the finance, the treasurers and that. And a lot of things that Councillor Galloway talked about, they've mentioned in this report. You know, and I hate bringing up my past experience, but as chair of TAPMO, I've been fighting a long, long time to have TAPMO pay their fair, our aggregate industry fair taxes. You know, pay for the land they use. Instead, the impact has classified them as farmland. So what that means is for every dollar of taxes that they're supposed to pay, they pay 25 cents and the rest goes on residences. Okay. So you take the residential tax person, which is most of us, and we're paying 75 cents of the tax dollar that was to go to aggregate onto ourselves. We're paying that for the same for farmland. We're offsetting that. And then on top of this business tax thing. Now, Councillor Gallery brought up some really important points. And I would hate for us, Craig, to go through and talk to the businesses and say, oh, what a great idea. They can save this money and that money and everything else. And then actually have up the burden to the councils. And this is how my staff put it. The administrative burden added to the township, while the region has to approve the property subclass, it will be up to the lower tier to actually administer the program. The time involved could be significant. Staff would have to either define the criteria or create the application, process it each year, and deal with the potential appeals. Access to the information. The programs are very flexible in that it allows you to define small business in a variety of ways. We have access to assessed value of business properties. We don't have access to the independent records as to how many staff they employ, what their income is, etc. We would have to obtain this information, and the auditor in me would want to know how we are to verify it. Official CRA records, would they be willing to provide? Could be a roadblock to the criteria based on the program. How would we confirm application information? And fairness. If we are distributing the property in the same class, this could provide for an unfair business advantage to one business over the other. If you shift the burden across the entire tax basis, this moves more tax burden on the residential class. And that's just a few notes from them. That was from my staff, not from my counselors, who all small business owners totally disagree with this as well. I think we have to look at the impact on the municipalities before we even decide to step huge steps forward, because it is burdensome. You're creating a whole separate administrative body for this thing, and the appeals and everything else, and also disclosure, and also do people try to? And I'm sorry, from aggregate, I know that some of the industry cheats. And so is this encouraging cheating so they can keep it a subclass lower enough to receive the break? And that will happen. So I think that we're going around this backwards. I think we need to really see how it works, or if it can work, before we go out to the business and say, what do you think of this? I think we really have to analyze what we're taking out to them and have a good business plan before we approach anyone. And this, in our opinion, and my council and staff's opinion, is not a good plan. Thank you.
I wonder whether Mr. Dyer can speak very briefly to the questions we'll be asking of the groups that we consult with.
Yep. Through you, Councillor Clark. While we haven't we certainly haven't put all of the consultation material together. At this point, I would anticipate that we would provide an overview of what the province, of the changes that the province has made to the Municipal Act, the decisions that the municipality can make in terms of establishing the subclass, talking about some of the administrative and program design options, but also, as I said earlier, putting the question out to the business community about is there a particular problem from the perspective of the taxation of business properties that we think needs to be solved, and is this a good solution? Right now, we calculate a uniform tax rate across all commercial and industrial properties. We have the same tax ratio for both classes, and that produces then the same tax rate. And so the question is simply, is there a segment of the business community that should be taxed at a lower rate? And if so, why? And if so, what is that segment of the community? That's what we would need. That's what we would need to try to find out. To the comments that Councillor Foxton made, I'm inclined to agree with the feedback that she's been provided, by her staff. That's, I think, an accurate description of the conversations that we've had at area treasurers. I think from a regional staff perspective, we'd be looking for guidance from council at this point about whether this is something that you want staff to go out and consult on this year, or whether we want to put it on hold. There isn't a time limit for going through this process or putting this kind of class in place. And if it was council's wish that we don't go and do consultation right now, that would be good for us to know, and we would turn our mind to other matters.
Would somebody like to make a motion to that effect? So just for my own understanding, to sum up, there's no decisions being made. There's an opportunity that the province has presented. This is a process for us to begin to explore whether we want to take advantage of the opportunity. And a report will be coming back to us in the spring on these sort of preliminary steps. But what you're suggesting is, if we decide as a council that we don't want to pursue it, and we know we don't want to pursue it regardless of what the input is, we could stop the process at this point. Am I correct in that?
Yes, that's absolutely correct.
Chair Redmond?
Thank you, Chair Clark. I think uncertainty is probably the worst scenario, but I think that there are voices out there that would want to have their day in court or be able to provide input. So my suggestion would be, rather than a motion, could we just direct staff to say we're not in any hurry? How we do this consultation is very important as doing it, and come back in the spring outlining what the consultation process would be, so that all voices are heard. I certainly have great reservations too as I read through the material, but I do think we have an obligation to the community that they have an opportunity to weigh in this. I also recognize that there's no ticking timeline within which we have to do this. So my suggestion would be that in the spring, staff come back with a robust consultation process, at which point council can then make a decision.
Thank you, Chair. Councillor Foxton, I saw your hand go up and down. Are you satisfied, or?
I'm not sure. When you say, Regional Chair, when you say consultation with whom? Because I would like to hear again the dynamics of a program before we go out to the public and say, oh, look, we can offer you this deal, but we don't know how it's going to work or the constraints it's going to put on us.
So I would suggest that would be part of what staff would bring back. But I also recognize that consultation, when it is authentic, you do have to leave room for other voices. So I wouldn't want to necessarily go to the community with a fait accompli as much as perhaps these are value statements, these are impacts that we're flagging. And here, Councillor Fox, and you mentioned some of them, passing on, and so did Councillor Galloway, passing on savings to tenants and things like that. So I think all of those values and in that overarching conversation is really important to formulate, but I wouldn't want to go necessarily to the public and just saying X is our decision without having them have input before we make that decision.
Councillor Galloway.
I agree with Chair Redmond. I think we should put it off for a period of time. There's no rush, but I do think that we do owe the community the conversation. I'm not predisposed to it, but I think we need to establish whether or not, as Mr. Dyer indicated, I mean, does even the business community want this? The municipalities maybe don't want it, and that's a good thing to find out as well as part of the process. So, and then we can make a decision whether or not we're going to even develop scenarios or go any deeper into it. It may well be that we'll decide to truncate the process at that point.
All right, I see no other questions. I think, Mr. Dyer, that we're clear on our next steps. We're just not entirely clear on when, and COVID will help to determine that.
Understood. Thank you for the guidance, Councillor Clark.
All right. Thank you, everybody. That item was from our consent agenda. However, we'll now move on to the items. If you wish to remove an item from the agenda, please indicate so now. And I see Councillor Jowett.
Thank you, Councillor Clark. So I tried to find the actual consent items, and I know we've been making changes. So, and I hope I don't appear like an idiot here, but
they're all consent agenda items this time.
Okay, so everything is. So there's no segregation. There was nothing left on the table. Okay.
If it's on the agenda, it's a consent item.
Perfect. So I'm fine with that. Thank you very much.
Councillor Galloway.
Thank you, Madam Chair. Not to, doesn't necessarily, it's for information only, but it's the end of mortgage item, which is the next item in any event. And I don't know if Mr. Petitpierre can answer this or not, but I think I've raised the issue before, and I don't know if this report relates or how much this report relates to the issue where we have heard about various properties that have been provided capital grants in the past, where the covenants are now coming due, and there are investors actively pursuing buying up these properties and taking them out of the inventory of social housing or affordable housing. And because there's just a whole lot of uplift potential to these properties that no longer have the covenants, the mortgage covenants that they had and agreed to when the capital grants were being provided, 20, 25 years ago. So I was just curious to what extent, if any, this particular report related to that issue.
Good to be here.
Thank you for the question, Councillor, and through you, Madam Chair. These are a separate category of physical assets, Councillor Galloway. The properties that we are speaking to in this report are similar to those owned and operated by Waterloo Regional Housing, for example. They were devolved to our administration from the province of Ontario in 2001. And the funding formula and the agreements that we administer based on that are tied to the mortgage. The class of asset that you're referring to are the later version of how we've been administering affordable housing over the last few years, where we contribute a capital amount upfront to the development and request a period of affordability for a number of years. This class in the not-for-profit and co-op sector is more tightly legislated and administered. That being said, with the expiry of their operating agreement, there is potential for them to opt into an exit agreement, as indicated in the report. The conditions of that exit agreement and what that may mean has not been spelled out in the legislation from the province at this point in time. So the conditions and factors that should they choose to exit the housing services agreement, we don't know necessarily what that would look like, but they could potentially be leaving the system. So in that instance, there's a potential that there's a similarity between the class of assets that we've been supporting more recently, but they are two different classifications. I think is the straightest answer I can give you to your question at this point.
So, Mr. Petitpier, would it be possible then with an exit agreement that the nonprofit could decide to sell the asset to a REIT or some other investor who's looking to buy the property, take it out of the affordable housing inventory, and make it a good investment for themselves?
Through you, Madam Chair, not knowing the requirements or restrictions that the province may come through with their legislation, the best I can answer at this point in time is that it's a possibility. Remembering that these are owned and operated by not-for-profits and co-op housing providers that have their own articles of incorporation and other conditions of their boards. That being said, should they exit, address those and go through any other number of steps, that is a possibility. And that is one of the concerns that we have and why we are trying to engage proactively in advance of even knowing what the legislation that the province will bring forward is. We're trying to do our best to protect these community assets and community investments to remain in the system, and not just remain, but to stabilize and offer them the opportunity to grow and get back to really what their original intent was, 20 years ago upon incorporating. It's about the best I can answer that one at this point in time, not knowing where the province will go with their legislation.
Well, I'm glad to hear that, Ryan, because we do know that there are institutional investors, private investors who are very proactively seeking out these properties to turn them around out of affordable housing and into more profitable housing at market rents. And that's really kind of disturbing and discouraging. So anything we can do to forestall that for this class of units, but also for the other class of units, I think we need to be very proactive on. So thanks.
Councillor Foxton.
First, I'd ask Chair Redmond if her topic is on the same, because I'm going to go to another item. It's not. Okay, thank you. I just want to say that the township, my staff and council endorses the 2 roundabouts in North Dumfries Township. We thank you for those coming. I really like that staff has been able to protect the Dickey Settlement School, which was built in 1847 and was only closed in 1999. And they are being able to change the road and ways and the roundabout so that the school is not harmed. And I am very much appreciative of that. So I just wanted to show our support. Thank you.
Chair Redmond.
Thank you, Chair Clark. And I want to be quick. I'm not asking for this to be taken out, but the Immigration Partnership Council Refugee Task Force update, I just really wanted to highlight the coordinating function that the Immigration Partnership Council provides to a full community response, and also to underscore, and it's in the report, I'm sure we've all read it, that we're expecting 1,800 Afghan refugees to move into Waterloo region over the next 2 years, together with refugees from other countries, which is about 350. And I just really want to underscore the importance of this oversight and coordination, and thank the community for continuing to step up to make sure that these newcomers are incorporated into our community as smoothly as possible.
Thank you, Chair Redmond. Just a brief comment on the issue of the end of mortgage, and I know that Councillor Galloway was not suggesting that the not-for-profits and co-ops are greed motivated, but I think the assumption of the province has been that once mortgages are taken care of, the need for ongoing provincial assistance won't be necessary, and I think that, of course, every provider's situation changes, but I think that providing truly affordable housing is expensive, and I think that there does need to be some. I don't think we can simply assume that all providers are going to be fine when they're no longer getting this assistance and can continue to deliver affordable housing, at least not in the way that that we've defined it in the past. Councillor Verbanich.
Thank you very much. Just as a follow-up to Councillor Redmond's questions with respect to the work that's being done by the Immigration Partnership Council with respect to the resettlement of Afghan and other refugees, I'm wondering if staff can just comment. I know when we dealt with the Syrian situation a number of years ago, there was a model set up that involved the region, lower tiers, and community partners. And that model actually was praised both locally and subsequently nationally in a follow-up meeting that former Governor General David Johnson had with respect to the work that was done locally on that. I'm not aware, and I maybe missed it, but that something similar has occurred in this situation. And with the numbers that we're talking about, I think it would actually be of benefit to the circumstances. And so I'm wondering if staff can comment on that and what we might do, in fact, to get that back up and going, because it really does take a village, and a whole of community approach might be helpful.
Mr. Loeffler.
Yes, and I believe Tara Bedard is on. She may want to comment further. I know this question came up late last year as well from someone, and my understanding is that there's a significant difference between the Syrian situation and this one, particularly in terms of pacing and the number of years it's going to take for government to repatriate Afghan refugees. But I think Tara is on and may be able to clarify if that's the case or not. And I think there are plans in the future to set that up as things start to accelerate.
Go ahead, Tara.
Good morning, everyone. Through you, Madam Chair, happy to be here this morning. It is true that we anticipate that the timing and pacing of the resettlement is going to be different than when the Syrian initiative was taking place in 2015, 2016. As of right now, the federal government is indicating a roughly 2-year timeline on their ability to meet that commitment of 40,000. And I'll underline here, we said in the report, we're using the 1,800 as an estimate to support planning across our systems in the community. There are not yet, and I don't know if there ever will be, any firm indicators, like by community across the country, exactly how many refugees we can anticipate receiving. It's very complicated in terms of what that actually looks like in the end, with where the government is trying to destine the refugees who are government sponsored, where folks who are arriving in Canada want to go, the connections that they're making along the way. Some of them get to know people and then want to move across communities. And also it will depend exactly how much appetite there is in Waterloo region among residents to get engaged in private sponsorship. But we recognize that many big systems are implicated in the resettlement efforts. And so we're trying to put some kind of a number. We tried to put some kind of a number together based on the experience with the Syrians to help our systems start to look at what their supportive capacity looks like and what it could look like depending on, whether there's just kind of a slow trickle of people into the community over the next couple of years, or whether we reach, certain times when there's surge of arrival. And that we just have to wait and see as we get information from the federal government in terms of what that's actually going to look like from day to day in the community. We're also, very clear that we're operating in the context of a pandemic, which is stretching capacity everywhere. And so we have talked about with our task force, we are leaning into supporting the leadership of systems across the community to be able to meet the needs of the families as they are arriving. We have talked about, how successful it was having that direct connection to be able to provide updates and share information with our municipal leaders, to lean on you for support at times when that is needed, and having a voice with systems leaders, upper levels of government. We are talking about what that structure looks like and what is needed while we know exactly, how busy everybody is with everything else. So, the point of the report today was to provide a little update on some of the work that is happening in the community, to remind you that we are working to support this initiative. We will continue to come back with regular updates. And if there is a desire for a more structured engagement, we're happy to work to put that in place.
Well, thank you. I guess on that, and I mean, Tara, thank you to you and the team who have been doing this work, particularly as folks are, as you note, a little preoccupied with COVID and in particular Omicron. But we also know that the government has some commitments that have been made with respect to Afghanis, which are larger than the commitments that were made with the Syrian population. And B, we know we've got to play some catch up as a country in terms of our immigration numbers because of COVID. And so, I think once we get over the next couple months, is once we get beyond this Omicron surge and have a chance maybe for a little bit of a breather, I would certainly like to see us bring that group back together. It may be one meeting, it may be several meetings, but there was a lot of benefit from it last time. I know Mayor Jaworski was part of it. Mayor McGarry would certainly have been aware of it from a provincial point at the time. I think there would be some real value in that. So maybe that's something we can target, for the March-April timeframe. And I think we're all hopeful that we'll have the peak will have passed us and we'll have had that little bit of a breather by that point in time. Thank you.
All right. Thanks, everyone. I see no more hands. What I would like is a mover and a seconder to approve the consent agenda items. And I see Councillor Foxton and Councillor McGarry. Please use your buttons to indicate yes or no. And I believe that is passed unanimously. I will note that Councillor Erb did have another commitment at 11 o'clock. He did let us know that at the beginning of the meeting, and he's had to step away. All right. That's the consent agenda dealt with. Give me 1 minute here. There are no reports on the regular agenda. We are on to information and correspondence. Any requests relating to that? Seeing none. Councillor inquiries and requests for information tracking list. Okay, I'm not seeing anything. I am going to let, I think this is probably the appropriate time. Oh, sorry, Councillor Galloway, go ahead.
Are we at other business yet, Madam Chair?
Yes, we are.
Okay. Can I go ahead then?
Yeah, yes, sorry.
Oh, okay, sorry. I was just a little confused where we were. Madam Chair, I just wanted to give direction to staff for a report on the MZO process that's generally, but also that's taking place in Wilmot. I think we're all getting inquiries, and we need to understand, of course, how the MZO process actually operates in a general sense, who initiates it, and how it goes through the process, including the minister, but also the potential impact to the ROP review in regards to this particular. So I'd like to provide direction to staff to come back with a report. I believe at the next cycle, or I think that what is the date in February, Caitlin?
February 8th is the next committee of the whole meeting.
Yeah, for the meeting of February the 8th.
Mr. Aguirre?
Yeah, thank you, Councillor Clark, or Chair Clark. Yeah, we'd be happy to provide an information report to Council about the MZO process, particularly in the context of the regional official plan review process that's currently underway. The MZO process itself does not invite the region to participate, but certainly we can bring information to Council that would clarify some of the issues that are invoked by the process.
Right. Thank you. We'll look forward to that. I am letting Council know that I will be bringing a motion as well relating to Bill 21, which some of you know is sort of bubbling back up again in different ways. I am having conversations with the Coalition for Muslim Women to sort of shape what that resolution will look like. So I will provide that information as soon as we've got some meat on those bones. Is there any other business? All right, seeing none, our next meeting is February 8th, and I am looking for a motion to go into closed session. I see Councillor Nowak and Councillor Kiefer. Please use your buttons. And that is passed, that a closed meeting of Committee of the Whole be held on Tuesday, January 11th. Optimistically, we thought it would be 10 a.m., but it will be 11:15 in accordance with Section 239 of the Municipal Act for the purpose of considering the following subject matters: labor relations. And I'm going to suggest that we reconvene at 11:15 to give everybody a chance to do what they need to do. Thank you. I think we're on the same link. I believe we are.
Yes, the same link. Yep.
Turn off your cameras.